I have dense breast tissue, and if you've ever received a letter from your mammography center telling you the same thing, you might have wondered, what does that actually mean for my health? Today, I want to talk with you about something that could literally save your life. Hello, I'm Shelley with Inspired Well. October, as you know, is Breast Cancer Awareness Month. And while we hear a lot about getting mammograms, we rarely hear about what to do when those mammograms might not be giving the full picture. I'm a registered nurse and health coach, and I'm sharing this information to help you make an informed decision about your health. Today, you're going to learn about what dense breast tissue means and why mammograms may not be enough and what additional alternatives exist. So let's start with the basics. What is dense breast tissue? Well, dense breast tissue simply means that you have more fibrous and glandular tissue than fatty tissue in your breasts. And here's the challenge. On a mammogram, both dense breast tissue and tumors appear white. It's kind of like looking for a snowball in a snowstorm. Now, if you're sitting there thinking, okay, how common is this? Here's what I want you to know. 66% of premenopausal women and 25% of postmenopausal women have dense breasts. That's the majority of women in their childbearing years and a significant number of women after menopause. So you're not alone in this, and knowing that you have dense breast tissue actually empowers you to make better decisions about your screening options. In fact, this is so important that the FDA now requires mammography centers to notify you if you have dense breast tissue. They wouldn't require this if it wasn't really important. When I received my notification letter a few years ago, I remember reading it and thinking, okay, so what does this mean for me? And what am I supposed to do with this information? The letter basically said that I had dense breast tissue and that I should talk with my provider about additional screening methods. But it didn't really give me any clear next steps or alternatives. And I realized that so many more women are probably receiving these letters just like I did and feeling confused, anxious, and wondering if they're doing enough to protect their health. So I want to give you the information that I wish I would have received back then. Because here's the thing, if dense breast tissue is this common and both the tissue and tumor show up white on a mammogram, you might be wondering, does this mean that my mammogram might miss something? So let's talk about what the research actually shows. The short answer is yes. Mammograms can miss cancers in dense breast tissue. Research shows that mammography sensitivity drops significantly as breast density increases. For women with dense breast, sensitivity can drop up to 48%. That means mammograms can miss more than half of cancers in the densest breast tissue. So let that sink in for a moment. The test that we've been told is the gold standard for breast cancer screening is only catching about half of the cancers in women with dense breasts. But it's not just about detection. Dense breasts also absorb more radiation. And here's something that really opened my eyes. Over a 30-year period, the use of mammography led to overdiagnosing 1.3 million women in the United States. That's 1.3 million women who receive treatments for breast cancers that may not have ever spread or caused harm. Now, I know this might sound alarming, and I want to be clear. I'm not telling you to stop getting mammograms. What I am saying is that you deserve to have all the information so you can make the best decision for your body. And I'm not alone in questioning the effectiveness of mammography, especially for women with dense breasts. Some of the most respected voices in medicine have raised these same concerns. In fact, Dr. Otis Brawley, the former Chief Medical and Scientific Officer of the American Cancer Society, has said that mammography is a suboptimal test and that we need a better test. And a study published in the New England Journal of Medicine stated that screening is having, at best, only a small effect on the rate of death from breast cancer. And an article in The Lancet concluded that screening for breast cancer with mammography is unjustified. Now, these aren't just fringe voices. These are respected researchers and physicians who have spent decades studying breast cancer screening. There's even a powerful documentary called Boobs, the War on Women's Breasts that investigates this controversy. It features medical experts scientifically debunking the myths of early detection and low radiation that we've been told for years. And again, I'm not sharing this to scare you or to tell you to stop getting mammograms. I'm sharing this because you deserve to know the full picture so that you can make an educated decision. And the good news is there are alternatives you may have never heard of that can give you information about what's happening in your body, sometimes years before a tumor even forms. So let's talk about what those alternatives are. The first option I want to share with you is advanced breast thermography. Now, you may have heard of thermography before, but advanced breast thermography is different from traditional thermography. It uses highly sensitive digital infrared cameras that can measure minute temperature differences. Instead of looking for tumors like mammography does, thermography looks at what's happening physiologically in your breast tissue. It detects heat patterns, blood flow, and vascularization. And here's what makes it so powerful. It can identify these changes years before a tumor even forms. Advanced thermography uses black and white imaging to show vascularization, and then the images are analyzed with sophisticated computer software that can recognize patterns the human eye might miss. It's completely non-invasive, radiation-free, and the research is pretty compelling. Over 30 years of studies involving 300,000 participants and 800 peer-reviewed published studies have shown 90% accuracy and 88% specificity. Advanced thermography also includes something called hormonal grades, which assesses estrogen stimulation in the breast tissue. And this gives you even more information about what's happening in your body. Now, you might be wondering what's the difference between advanced thermography and traditional thermography. So I want to clarify that. Traditional breast thermography uses infrared imaging to detect temperature differences, and it identifies areas of increased heat that could signal inflammation or increased metabolic activity. Advanced breast thermography builds on that foundation, and it uses highly sensitive digital cameras that I mentioned earlier, black and white imaging to show vascularization in greater detail, and then the images are also analyzed with computer software, and it includes the hormonal grades, which all of that just gives you more information about what's happening in your body. Now, the second option is automated whole breast ultrasound, or AWBUS. This is a computer-guided robotic system that uses a large transducer to scan your entire breast and create 3D images. It's kind of like a movie for your breast tissue, rather than just snapshots. And AWBUS is particularly effective for women with dense breasts. Research shows that adding screening ultrasound can find 40% more cancers in women with dense breasts than mammogram alone. It provides standardized, reproducible whole breast coverage, which means that you get consistent imaging every time. And that makes it easier for you to track the changes over time. Now, you might also hear about diagnostic ultrasound, which is different from AWBUS. Diagnostic ultrasound is when a technologist manually moves a smaller probe over specific areas of your breast. It's typically used to evaluate something specific or suspicious that was found on another test. It provides high-definition 2D images and can even evaluate blood flow within lesions. Another option is the Auria tear test. This is a tear-based screening that analyzes your tears for proteins that are involved in the early inflammatory process associated with breast cancer. It's non-invasive and provides another layer of information. And finally, there's QT breast imaging, and that uses advanced ultrasound to create 3D images of your breast. It also uses AI to analyze the images, which can help improve image interpretation. Now, I want to be transparent with you. Some of these alternative methods are not yet FDA regulated or approved and covered by insurance. And that can be really frustrating, I know. But that doesn't mean that they aren't valuable or they aren't effective. It just means that the system hasn't caught up yet. And if you want to dive even deeper into this topic, I highly recommend watching the documentary Boobs, the War on Women's Breasts. There's also a YouTube interview with Dr. Jill Carnahan and Dr. Jen Simmons called The Smart Woman's Guide to Breast Cancer. And Dr. Simmons also has a book by the same name. All of those are excellent resources. So now, what do you do with all of this information? How do you actually advocate for yourself and have these conversations with your healthcare provider? Let me give you some practical steps for having these conversations with your healthcare provider. First, you want to come prepared with your questions. You might ask, given that I have dense breast tissue, what are my options beyond mammography? Or Have you heard of thermography or whole breast ultrasound? And would those be appropriate for me? For you are not being difficult or questioning their expertise, you're being a good steward of your health. And second, if your current provider isn't open to discussing alternatives, or if they dismiss your concern, it's okay to seek providers who are more aligned with integrative approaches and who respect your desire to be informed. And third, remember this: you are the steward of the body God gave you. It's not only okay to ask questions and seek answers, it's important. Asking questions and caring for your body is responsible stewardship. You are created on purpose for a purpose, and advocating for your health allows you to fulfill the purpose and plan that God has for you. Now, breast health doesn't exist in isolation. It's connected to your overall wellness, including things like detoxification, nutrition, stress management, sleep, and movement. When we support our body's natural detox process, we help reduce the toxic burden that can contribute to inflammation and hormonal imbalances. These are the kinds of lifestyle factors that impact not just breast health, but our overall vitality. And this is where I want to introduce you to a tool that can help you see the bigger picture: the Wheel of Wellness and Weight Loss. It's a free assessment that helps you to identify which lifestyle factors may be impacting your health across 6 key areas: mindset, sleep, stress, nutrition, movement, and detoxification. It takes just a few minutes to complete, and it gives you a personalized roadmap for where to focus first. So instead of feeling overwhelmed by everything you think you should be doing, you'll actually have clarity on what your body actually needs most right now. So you can download the tool at inspiredwell.org/wheel. And if you're looking for a supportive community of women on a similar journey, join the Every Woman Well community. It's a faith-centered online space without the noise and distraction of social media. Remember, you were created on purpose for a purpose. Advocate for your health, ask the hard questions, and choose what's best for your body. Until next time, stay inspired.